Hello, I'm going to be your doctor today. I know this is our first time meeting, so I'll introduce myself. My name is Caitlin. I already know yours. I have it in your file. Your other doctor faxed me over your file, and it is full of vital information for us doctors to use. So it says right here you are in for a cranial nerve examination today, correct? Okay. Have you ever had a cranial nerve exam that you can recall? You're not sure? It's perfectly okay if you're not sure if you've ever had one before. We have quite a few frequent clients come in who get them. Yeah, typically people get them after traumatic events, car accidents, or anything along those lines. You're just in for one because why? Okay. Well, I'm glad to have you in our office today. We're in a different room than we usually perform. There are some renovations going on, so we don't really have an eye chart up, but we do have a spare copy of an eye chart in which we will be using today. So I'm just going to make a note in your file that you're unaware if you've ever had a cranial nerve examination, okay? Okay. So to get started, we have quite a bit to go through. Typically we start off by doing a bunch of different exams, just testing out how everything is working to see if everything in your body, especially, well, mainly just your nerves, they're reacting. So the first nerve we're going to be testing is your olfactory nerve. Yes, your nose. Now, I need you to do one thing before. I don't want you to snort, but I want you to just breathe in and out. So not like you're sniffling. Do it very slowly. So just breathe in and out. It just kind of clears your airways for you and I to get started. Now, do you have any allergies to dyes, perfumes, or anything? Okay. If you don't mind, I'm just going to mark that also in the file. So the reason is, for this part of the examination, we test your sense of smell, and if you're allergic to something, we don't want to cause a reaction. Okay, so the first item we have is something that we use every day, or at least we should be using every day. I'm gonna hold it up to your nose. Yep. We typically have the patient waft in the smell instead of just straight up sticking their face into it. So I'll waft it in your direction for you. It was deodorant. Okay. I'm just going to mark that you got that correct. And the next one we have, they're both very feminine smells, so this might give it away a bit. Okay, so just waft in the smell again. Okay, so what do you think it is? It is lotion. It's impressive. Most people don't typically get the lotion. Most people assume it is a perfume or something similar. So now we're going to move on a bit, and This is a rather lengthy part of our examination. There are a few different steps we go through, so I'm just going to jump right into it if you don't mind. This is going to be the optic nerve. Yes, your eyes. So, do you wear glasses or contact lenses regularly? Okay. I did not see that in your file, so I'm just gonna make a little note. Okay. And do you have any other issues with your eyes? Irritation, twitches, anything along those lines? An eye twitch is perfectly normal. Typically an eye twitch just means you're stressed out or you have lack of sleep. They both go hand in hand though. So for me, when I was still in school, I would constantly get eye twitches around the time of final examinations as well as midterms, but usually finals week I would have constant eye twitches. It's just normal. But yeah, it's very expected. There's a few ways to get rid of an eye twitch, and it's usually just to sleep. You're not going to be able to get rid of an eye twitch by doing some special remedy. At least we don't recommend a remedy. We recommend just sleep. And of course you're going to have to bear with it for a few days, and they can be quite annoying, but we do recommend just sleeping them off and hopefully being able to live through them. Okay. Now I don't really need to mark in your file that you have eye twitches. It's very normal, but I like your thinking. So as I said, since we are doing renovations, we don't have an eye chart up on either side of the walls, but we have a portable eye chart, and I'm going to hold it up, and you just need to read to me some lines. So, for starters, will you cover either one of your eyes? It's your choice on which one you start off with. Okay. Can you read for me this top line right here? Okay. How about this fourth one? Okay. What about the bottom one now? Now will you switch eyes for me, please? Okay. Top line again. Second line, followed by the third one. Okay, and third. Okay, you didn't miss one, so I'm just going to mark for your left eye, you were fine, and for your right eye, you were also fine. It's good news for both of us. Now, to continue on, what we do is we take a better look at both of your eyes. So if you don't mind, I'm going to get a little bit closer towards you. Okay? And I need you to just trust me here. I'm going to look at your left and right eye a bit. I might also do a little bit of touching, so I hope you are comfortable with me prodding at your eyes. Okay? Okay. Okay. I did notice a bit of redness. Yeah, it comes with just being tired as well as stressed out. So, are you frequently tired? Feel the need for naps or a second cup of coffee? It's perfectly normal. It's human nature to be overtired or undertired and not have gotten enough sleep. It's completely normal. So I do recommend that you get anywhere from 7 to 9 hours of sleep. The minimum we recommend is 7. The maximum is 9. The ideal is 8 though. Okay. Now what I have to do is I have to shine a bright light in both of your eyes. Unfortunately, as I said, we don't have the proper equipment because of our renovations. So I am going to be using a flashlight from a cell phone. I hope you don't mind. And first what I'm going to do is I'm going to use the light behind me as well as the light from the phone and have it in both your eyes. We consider it to be double light. But then I'm going to shut the lights behind me and use just the light from the phone. So if you would, just bear with me momentarily. I need to see how your eyes react to light, if they react at all. We like to see pupil dilation. Other side. From different angles. Okay, now I'm going to get very close. I'm sorry, it's very bright, I know. Okay, now let me shut the light behind me. And we will be using just this light now. I'm just trying to test your vision, see how the reactions are. Just look into the light briefly for a second. Okay. Okay. Now, one more angle from the side on both ends. Let me turn the other light on and I will continue telling you how you did. So your eyes did dilate when the light hit it, which is a good sign. So your left eye was fine, and your right eye is also fine. The reason we have to use the double light is to see if it will respond differently to natural lighting. Yeah, it's interesting. You wouldn't really typically think that, but it does happen. So, continuing on with the optic nerve, I need to do 2 more things, and these are both very quick steps. So, you see my pen right here? Focus right on my pen. Now focus on my nose. Focus on my pen. Focus on my nose. Pen. Nose. Okay. Now continuing on, I'm going to move my pen around. And I want you to follow while you follow, I'm going to follow your eyes to see if there's any delay. Okay? Here we go. Yep, and just continue to keep your head still for me. Just watching your eyes in the back. Okay. And one more step. I'm going to, actually there's two more steps. I apologize, I lied. I need to do two more steps. They're both very simple though. What I'm going to do in my first step is I'm going to take two fingers and wiggle them on different sides of your vision. And what this will do, it will tell me how your peripherals react. And just see where your blind spot is and whatnot. So, just focus right on my nose right here. And then just either nod your head or say yes whenever you see either one of my fingers go, okay? I thought I'd trick you on the last one, but I didn't. So, just so I don't forget, I'm going to mark how you did on all three of those tests. So far, you have passed every single one of these examinations, which is very impressive. So, continuing on, I'm going to now do your hearing nerves. And typically what we do here is just see if we whisper something to you in either ear. I hope you don't mind me getting close to you. You will be able to hear both things in both ears, okay? Okay, so I'm going to get a bit closer. Is this comfortable for you? And now I'll whisper into this side and that side. And just repeat after me. 6, 8, 20, 50, 80. Good. Glad you got those. And now, the other side. 15, 28, 32, 70, 15 again. Perfect. The reason I chose to do two numbers twice is because it sometimes will confuse your brain and your hearing, but you understood both, so I'm very pleased with that. So your hearing was fine, which is very good. We like that you're hearing. It doesn't appear that any of your nerves we've tested so far have failed you. So now what we have to do is test your facial nerve. There are a few steps to this, but I'm sure they'll be quick and harmless. Excuse me. What I'm going to do is I'm going to touch either side of your face in a few different spots, and I want you to tell me when I touch them. Usually we use something like a cotton ball, but if you don't mind, I'm just going to be using my pen. Okay, let's get started. One more. Yep. You did wonderful. There was no miss. You didn't miss a single poke, and you had a good reaction. So that means your facial nerve is reacting well. And now we have to check the motor aspect of your facial nerve. And by doing this, we need you to do a few silly faces. But really, they're nothing. Let me just get your file ready so I can mark everything for all these different nerves. I won't be using that on your face anytime soon, so we don't have to worry. So, step 1, I need you to frown for me. Okay. Step 2, can you raise your eyebrows up for me? Are you one of those people who can raise one and not the other? See, I can't. I've tried, but I can't. Okay. This part I have to touch you, so I hope you don't mind. You need to shut both eyes very tightly. I'm going to try to pull them up, and I want to be unsuccessful, so I want you to be able to hold them tightly. Okay, so shut them for me. Keep them tight, don't let me open them. Okay, other side. Okay. Now, this part is not smiling. I need you to show me your teeth, starting with your top lid. Okay. Now your bottom lid. Now I need you to smile. You can smile first without your teeth, and secondly with your teeth. And now this one I need you to just puff out your cheeks. Wonderful. And we're getting to the end of the examination. I need you to do a few extra things for me. Can you shrug your shoulders? Okay. Now, can you shrug them? But when I grab onto them, keep them in the upward position. Okay. Stay still. And try to just keep them up. I'll try to push them down a bit. Okay. Good. It's a good reaction to have. Let me make a note of it. Now, is it possible for you to turn your head from one side to the other while I hold your head? Okay. So go. Keep it. Keep fighting. Keep resisting. Okay. No other side. Okay. I'm just marking how you react. And there's a few more parts, but they're very, they don't really have to deal with why you're here today. Your doctor informed me why you're here today, and what they are is they're just checking for symmetry throughout your body. So if your skull is perfectly aligned with the back of your neck, or if your tongue is has symmetry, as well as your eyes. It's very relaxing to do the back of the neck one because you get almost a mini massage at the same time, so I will do that one. But other than that, your examination is over. So just relax and I will just check the back of your neck. You have a bit of hair. Okay, so it does appear that your neck and head are symmetrical, but let me just double check this area right here. The reason is I felt something. It could have just been me, but it doesn't hurt to take another look, does it? Okay, other side. Okay, I think that you are very symmetrical. No, it's a good thing. You want to have all that symmetry. You don't want to have misshapen figures on your body, do you? Well, I appreciate you letting me get so up and personal, because I did get very close at some parts. And let me just sign off that you passed your examination. So on this bottom line right here, I'm gonna look. I'm just going to mark my signature, stating that you passed your examination and that you are all set. I'm very impressed with your results. You are one of the only clients I've seen come in recently who has just completely passed without one failure, so I'm impressed. If you ever need a doctor for anything else, a checkup, a physical, anything at all, I'm always here for you. I do know that you do have another doctor though, and I don't want to steal any of her clients away, but I'm always here. It was very nice to meet you as well. I hope you are feeling a bit better after this examination. Okay. Have a great rest of your day. Bye-bye.